You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hi, I'm Kasey, and I'll be your host for this week's episode of Nurse Converse podcast. Motherhood, the hardest journey I've been on to date. Nursing school, definitely the second hardest, without a doubt. Doing both at the same time was pure insanity. People often ask me, how did you do it? Looking back, I honestly don't know. The saying, it takes a village, comes to mind. When I was going through it, I took one day at a time. We shuffled the kids between my parents, preschool, and home. The mom guilt was the worst. I always felt torn. When I was spending time with my kids, I felt like I needed to be studying. When I was studying, I felt like I was neglecting my kids. I could never win. I was fighting a losing battle, and it affected my confidence as a nursing student and a mother. Not to mention my husband, who was neglected during the entirety of my nursing program. So let me share with you a story that is a perfect representation of the struggle. Fall 2015, and I am in my first semester of nursing school. During this semester, we had several skills check-offs in the lab, and I slayed the first one. I felt so confident. The instructor told me that she was actually impressed with my performance and that I should consider teaching in the future. I was beaming. This was a huge win for me. A couple weeks later, I go into my next lab skills checkoff. And at the time, my son was 2.5 years old and having a difficult time adjusting to preschool. My mom was in charge of picking him up that day, and everything was handled, or so I thought. I went into the checkoff, and I will never forget it. I placed the JP drain, the Jackson Pratt post-surgical drain, down on the bed and did not clean the opening with an alcohol pad. I failed immediately. My heart sank, and I felt like I was going to puke. I kept it together, and I left the lab, and about the exact same time, my mom called me. So I was going through my emotions, and I answered the call, and all I could hear was my son screaming his head off. He's so loud that I couldn't even hear what my mom was trying to say. Then my mom starts yelling, and I couldn't get a word in edgewise. Something was wrong with my son. He was unable to calm down, and I had no idea what was going on. So my mom tells me during this that Carson is having an episode and he won't calm down and he won't get in the car. And so he's standing in the parking lot at the preschool screaming his head off, which got a couple looks I can imagine. At this time, my mom informs me, in frustration, there is something wrong with your son. He is unable to calm down. And then she was telling me that as his mother, I need to follow up on his behaviors with his pediatrician. In that moment, I lost it. I stumbled into the hallway like an immature child, kicked a trash can, and ran down the hallway. I ran to a corner. I hung up the phone, and I couldn't stop crying. The sweetest classmate approached me. Everyone else obviously was pretty scared from my outburst. And all I could mutter is that I'm a failure. I'm a failure as a mother. I'm a failure as a nursing student. And at that point, it was very low. I share this story with my current students to make them laugh, but to also show we are all human. Really, when you think about it, motherhood is very much like nursing. You never know what you're waking up to. Some days I wake up and my kids are quite pleasant. No fights in the car. We make it to drop off on time. And I come home after work to no homework and the time to actually have a meal with my family before we separate for sports practices. Some days we wake up late and the attitudes are strong and the coffee is not strong enough. Math homework is overflowing. And if you have a middle schooler, you know how hard that math homework is. We usually have to find YouTube videos so that my kid can finish his homework before practice. And in nursing, some days I walk into the unit, finish a hot cup of coffee, catch up with a colleague. My patients are just peaches, and we just vibe for our 12 hours together. Other days, I don't get my coffee. I don't even get a bathroom break, let alone a lunch. I have a patient deteriorating, one screaming for a boxed lunch, and a family member who wants to speak with the charge nurse. In both motherhood and nursing, it's all about flexibility and pivoting. And for the most part, the good days make the harder days easier. I'm going to be honest, I don't know it all. Not nursing or motherhood. I'm just faking it until I make it. My son was my firstborn, and let's face it, I have no clue what I'm doing. Are there books? Sure. But in today's society, and as a mom who is working 3 jobs to pay for private school tuition, house payment, and travel sports, who has time to read them? Certainly not me. We're literally growing together. You can't always be in control. When I started my nursing journey, I had no clue what I was doing. I was certainly not in control. Overall, though, I'd say nursing is a great profession for a mother. You can make your own shift to accommodate daycare, your partner's schedules, doctor's appointments, life. You usually, if you work 3 12-hour shifts, you have 4 days a week at home. Now, of course, I always say that one of those days doesn't count because you're in complete and utter recovery mode. Whether you're coming off a night shift and you have to sleep the next day, or you're coming off a day shift and you're just so foggy from all the thinking that you've had to do over the last 3 days. Holidays away from your family is tough, but usually people are very accommodating on the unit, and usually the nurses who are younger, who don't have children, are more excited to switch to have off for New Year's Eve or for 4th of July. So I've actually had a lot of holidays at home with my family as a nurse, more so than when I did death investigation, honestly. There is a lot of flexibility with the schedule, and that I do miss. Oh, I miss that. Now, coming home to a family after a 12-hour shift is tough. I'm exhausted, mentally, physically, spiritually. My husband, he knows better than to even really look in my direction. And he kind of stopped asking how my days were. He always let me be the first one to talk. Kids, they don't understand. So sure, after serving my patients all day, I will get you a juice. Or, of course, you can come and cuddle with me. It's tough. And as they begin to grow, they understand a little more why I'm a grouch after work. But for those with young ones, soak it in. They won't always come to you first. I've learned by lived experience in motherhood and nursing. The 12-hour shifts are long, and the older your kids are, the more aware they are of your absence. When they are younger, you miss them terribly. You drag your feet dropping them off at daycare or at grandma's house. You get to work and you talk about them to all of your colleagues, proudly showing off your latest photo shoot. When they are older, they sigh when you tell them you're working at the hospital the next day, which means you can't take them to school, you miss dinner, and you're unable to take them to their sports. My daughter calls me via Snapchat and talks to me more on the phone when I'm at work than when I'm actually at home. I'm going to be honest, my family life is not conducive to working full-time bedside. Our weekends are mostly spent traveling for a cheer competition or freezing in an ice rink. It's invaluable to be present. My preteens will remember who took them to practice and who was there at their games and recitals. When I decided to leave bedside and pursue education full-time, my husband was over the moon. He had his teammate back. After years of shift work, my family needed me to sacrifice and work normal hours. And I'm going to be honest, I had a hard time at first adjusting to working 5 days a week. It took a couple months to adjust my entire circadian rhythm. Now, I could not imagine my life any differently. I can be a working nurse, professional, dedicated to my passion, and a mother. My favorite days are when my kids accompany me to work at nursing school. They love setting up the labs and playing the role of the patient during simulations and skills days. Unfortunately, neither of them have any interest in the medical field or nursing profession, but they are still learning. Recently, my daughter told me about a new kid in her class. Some of the girls were complaining about the fact that he was able to eat snacks in class. She noticed that he had an insulin pump and took the time to educate her classmates that this new student had diabetes and he needed to eat snacks to ensure that his blood sugar did not drop. I couldn't get over how much she knew. I was beaming. I was so proud of my girl. And wow, she is listening to me. Similarly, my son was talking about needles. He hates them. Even at 12, it sends him into a full-blown anxiety attack. He sat in the front seat of the car one day telling me a step-by-step tutorial on how to give an intramuscular injection. Honestly, it was better than most of my first semester nursing students. My goal is to make sure my kids see their mother happy in life and in my profession. I can tell how proud they are of me. They always make sure to tell their friends I'm a nursing professor and that I'm going to school to become a doctor. It's a DNP. As adults, we spend so much of our time at work. We sacrifice time away from our home and from our families. I truly believe that work doesn't need to be negative. My kids see a mother who is passionate about her profession. Yes, we make sacrifices, but in my family, success is a team sport. When I walked across the stage at nursing graduation, my husband pinned me. My babies were sitting in the audience with my mom, stepdad, dad, and older brother. My son was 5 and she was only 3. Did they understand what was actually happening? Probably not, but I knew they were there, and that's all that mattered. In retrospect, being a mother has made me a better nurse and a nurse educator. I wouldn't have it any other way. Even today, when I was planning on coming in to record this episode, I had to pivot. I had a specific time slot that I knew I needed to be here to record. And last night, my daughter really started to feel ill. She had a fever, sore throat. It looked like a classic strep case. This morning, my mom offered to take her to the doctors, and my daughter begged me to wiggle around what I had to do at work so that I could take her. And sure, was it a little irritating or frustrating that I'd had this full day planned of getting a lot of things done in the office, getting myself kind of organized for the really busy week ahead, not only at the hospital, but also at the nursing school. But when she looks at me and asks, how could I not? She looks to me for everything. And she loves the fact that she has a personal nurse. It wasn't strep, surprisingly. I definitely would have lost money on that. But it's really important to know that I'm there. It makes me feel happy to see her happy. So when you're thinking about pursuing nursing, whether it be starting the journey or actually being bedside or even pursuing an advanced degree as a provider, do it. They're watching. They're always watching. People always think that you can't go to school, you can't have a profession, you can't be a working mother. If you have a village and you have that support, you can do it. My favorite saying about parenting, the days are long, but the years are short. Soak that in. I'd love to hear your perspectives on parenting and being a nursing professional. You can reach me on Instagram at Dr. Nurse PRN.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.